beautiful, beautiful Thursday, Dr. Martin. Yes, in person, but not seated across from me. Sorry, we go through the rigors
in person, far away from you.
In person, far away from you. It's a beautiful Thursday. Are you feeling good?
I feel wonderful.
Oh,
thank you.
And I hope you had a fabulous day.
How are you doing?
I am good. I'm good. Did you have a wonderful day?
Yes, I did.
Okay. I am glad. I am glad. Ladies and gentlemen, it's time for Health Zone. Dr. Monica Martin is my guest, and reminding you, she is a gynecologist and acupuncturist, a woman with so much knowledge, a doctor. She is a graduate by way of Arden High School. And yes, and I have forgotten the other areas of excellence, so you can catch me up on that at another time, Dr. Martin.
Okay.
But I want to say welcome once again. It's another second Thursday with Health Zone. Ladies and gentlemen, this evening we would like to discuss the topic of ultrasound. Ultrasound.
Yes.
Because I had a doctor on Monday, Dr. Martin, from the Princess Margaret Hospital. Dr. Cecil Batchelor. He's a senior medical officer. Yes, in Jamaica, in St. Thomas. That very impoverished, they say.
Yes.
And they are really trying to get an ultrasound machine because he has concerns about spectators and wanting to determine if the fetus is growing, normal and all of that. But interestingly, I just had an interview from Jamaica with Christine Stapley Banks. Her son was diagnosed with cerebral palsy after several months of her noticing that, he was not developing normally the things he should have been doing at 3 months, etc. He was not doing. And it is by way of the ultrasound that all of this was detected. Yes. So we do realize that having an ultrasound is important. So this evening we would like to discuss the purpose, the importance, and the necessity, among other things that your expertise on in this regard. So I would like to say welcome to you once again, and
thank you so much, lady.
We can start our discussion on ultrasound.
Well, on the topic of expertise, this is not really my area of expertise, but because I have to use ultrasound so often in my work, you have a basic working knowledge of how important this modality really is. It is very interesting because ultrasonography or ultrasound started out about 60 years ago or so. Very beginning, when people were just checking to see if the baby was there, the baby was moving, if the head is first and then if the feet are coming first. Now it should have gotten so much more sophisticated. When you spoke about that baby, it's a sad situation. I don't know if this was in Jamaica or here. But, in this day and age, when we have so much good ultrasound and Doppler and all these three-dimensional work that's being done in the field, there's so many tiny little complex detail that can be diagnosed in the womb. And in a way, it's unfortunate that when these things are not applied, that the babies end up suffering, and of course the family.
Yes, this took place in Jamaica 12 years ago. He's now 12. At first they, almost sent him home to die, as though he would not survive.
Wow.
Yes, so, I know how that works there.
Very sad. Very
sad.
So, as I said, the field of ultrasonography has really undergone dramatic changes in these 60 years, actually. And even though it's used in all branches of medicine take advantage of this amazing technology. But the field of OBGYN, I think we benefit maybe a lot more than in the fields, because it helps in every aspect of obstetrics and gynecology. Obstetrics is very, very key, because here it is, you can, the first trimester of a pregnancy, which is the first 3 months, so to speak, involves, actually starts from ovulation, fertilization, implantation, organogenesis, when the organs start to form. That whole phase is a phase that ultrasound did not really help much in the past. As a matter of fact, there was a thought that well, it was not an unfounded thought really, but there was the thought that the sound waves could actually be dangerous to the fetus.
Yes, I recall that.
Yes, you know, because that's why it's called ultrasound.
Yes.
The sound waves can be dangerous to the fetus. Now, after years have passed, they've found that, you know, studies and everything, and just with experience, that and with improving the machines, they have found that these waves are not really dangerous at all. So we can do ultrasound and the fetus just at implantation, even before the first missed period, you can actually do ultrasound, and it's safe for the fetus. And that is the phase where you can really pick up a tiny little problem. And in that first 3 months of pregnancy, when you can really, you know, look at the placenta, you can look at the vasculature, the blood vessels of the placenta, to see if they're positioned correctly, if they're in a position where the placenta may end up separating down the road and cause bleeding. A woman can diagnose before any incident, and certain corrections can be made. Conservative management, bed rest, and so on can be done to eliminate the disaster, the potential disaster down the road. Ultrasound is playing an amazing role in medicine, and as I said, in every aspect of medicine, but in obstetrics, which of course, you know, in obstetrics we deal with a mother and we're dealing with a baby.
Right.
We're dealing with a baby's growth, we're dealing with a baby's well-being, and so it's extremely important that this modality in medicine has really gone so far and has done so much, the OBGYN specialty.
So can I say then that ultrasound should be used in a prudent manner to provide medical benefit to the patient?
Definitely. It's very beneficial to the patient. And, you know, when you as an obstetrician kind of neglect to do certain, to investigate certain areas, then, as I said, the baby and mother are left with, you know, you just told me about your friend.
Yes.
The baby and the mother are left with the consequences. And so I recommend that when people, and depending on their situation, you know, it depends on whether you're high risk, low risk, medium. You categorize depending on your lifestyle, your health, if you're diabetic or if you're hypertensive. It just puts you in a different category.
Yes.
So your doctor is more vigilant, more observant, you know. Make sure nothing goes wrong during this pregnancy.
Okay. Now, many people have been doing ultrasounds, you know, for many years. Are there areas of the body that cannot be imaged?
Well, let me think. Most areas of the body, you know, well, obviously, if you're trying to find bone, you know, problems with bone, broken bones, ultrasound would not be helpful. You need X-rays for that or MRI. But most of the tissue, the organs of the body can be definitely examined with ultrasound.
Yes.
The brain, the heart. In cardiology, they call it echocardiogram, which is the same like a sonogram of the heart. The liver, the spleen, the bowels. You know, you can look for tumors throughout the body. And, you know, male, you know, men, testicles, all of these areas can be ultrasound.
Okay. And I also could ask you, I could also ask you then that if you don't have a medical condition, then an ultrasound should never be recommended.
You're talking about the non-pregnant person?
Yes.
If you don't have a medical condition in terms of what? In terms of symptoms? You can have no symptoms and your doctor is concerned about certain things.
Mm-hmm.
And in my own GYN, I do a lot of a test called 25, the cancer antigen 125,
mm-hmm.
and that's the protein that sort of screens for cancer.
Mm-hmm.
And you can just screen for it, just to screen, and then you find that, oops, it's elevated.
Mm-hmm.
The patient has no enlarged ovary, but you still send them for an ultrasound
mm-hmm.
to evaluate, let me check and see if your ovary is okay, because why do you have this elevated protein?
Oh, okay.
And then you may send them for a sonogram, and, maybe they have small fibroids, which can also give a false positive. You say, okay, don't worry about it, you just have fibroids, and just watch that, but it's not cancer.
Mm-hmm.
But, and ultrasound, this is on a page, take a lot of your clinical judgment.
Yes.
And that's the key thing, your clinical judgment as a physician as to what your patient, what diagnostic tool you need to use for your patient.
All right, Dr. Martin, I'm going to put you on hold because I see a call coming. Hold on, okay?
Okay, no problem.
All right. Welcome to the show. Hello? Hello? Yes, Dr. Martin.
Yes.
Mm-hmm. Go continue.
Oh, okay. So, you were just asking if the person has to be, if the person is not sick,
yes,
or
and well, I should perhaps
problem,
be more
clear. Ultrasound warranted.
I should be.
So it depends on the clinical picture that the doctor sees. But most of the time, most of the time, if there's nothing, there's no need for an ultrasound.
Mm-hmm.
If there's no reason, no valid reason, there's no need for it. Yeah.
Right. How does someone prepare for an ultrasound?
Well, it depends on what aspect the doctor wants to evaluate. Most of the time, if you're going to do ultrasound on maybe the liver or the bowel, you might want to tell the patient to avoid foods and, greasy stuff, and to make sure they hydrate themselves. There's some ultrasound that need for you to keep your bladder. The ultrasound people usually call and give the direction.
Dr. Marty, can I give you a joke? I had to go and do an ultrasound one time. So they said I should, drink water. The operative word was I should drink plenty water. So I drank up all this water. And so the technician, during the examination, he said... I'm
laughing because I'm okay, go ahead.
No, I had to put myself in this evening. And so the technician says, what were you doing? Your bladder is so full. I said, I was told to drink plenty water. He said, not this much.
I did it. Because if it's too full, sometimes they can't really see.
Exactly. Poor man said he couldn't see. So he had to, you know what he had to do? He had to give me a break. He allowed me to go to the bathroom and
let some of the water out.
Yes, and so we were fine after that. But I had to ask, because if they're not clear, because in my mind I'm thinking, oh well, they really need to drink all this water and stuff. And I was doing a very good job of not wanting to rush to the bathroom or anything.
Yes.
But
that's a lot. That says a lot for your bladder strength.
There you go. Because I was able to hold that, and I was
wonderful.
I was good, and I drank a good amount of water.
Okay.
Oh Lord. Now how do...
Well, they have the transvaginal technique now, which sometimes you don't need that water, because the transvaginal which is when they put the probe through the vagina, it looks straight at the organs, and sometimes that water thing you don't really need.
Don't really need.
Because some patients get very uncomfortable.
Yes.
And so on.
18 minutes. I do apologize. I apologize. 18 minutes after the hour of 7 o'clock. Health Zone is on with Dr. Monica Martin and yours truly, Lady D. We're discussing ultrasound this evening, its importance and necessity. Do you have a question for Dr. Monica Martin? You may call 914-600-4228. 914-600-4228. 914-202-4934. That's 914-202-4934. Call with your question. She is willing and capable of answering them. All right. Now, are there any possible complications where ultrasound is concerned?
Usually not. As I said, that is not my area that I work in on a daily basis, and I'm sure those people would have, incidents, things that happened, but I send my patients for the vaginal probe. Sometimes I call the radiologist and say a few words to them because, you're entering the vagina, the woman is pregnant, you don't want the probe to go in the wrong area and the patient has a miscarriage. If a patient has any problem where the cervix is starting to dilate, like she's looking like she's having a miscarriage, I don't think I want anybody putting a probe there because we can make the diagnosis always. But in general, the ultrasound has turned to be a very safe procedure, and as I said, actually there are exceptions, but in general, it's a very safe procedure, I would say.
All right.
Very handy, very helpful for all the specialties in medicine. As you know, I literally have two specialties, obstetrics and gynecology. Yes. And in gynecology, I use it a lot for ultrasound. For evaluating fibroid uterus, tumors, check if the fibroid is growing. Somebody has fibroid, you want to make sure. Some people don't want the surgery right away, or they want to hold off. You want to make sure it's not growing. Fibroid very rarely can jump from being a benign, non-cancerous tumor to malignancy. I see. And one of the signs is a quick growth from a regular fibro or a myoma to myosarcoma, which is a very violent cancer. You have physicians, quite a few physicians here and there, and the patient just keep putting off the surgery, and when they went in, it's all cancerous. Oh, no. But because it's so rare, I try to tell people, don't be scared, but at least know that if you have fibroids, just check with ultrasound every now and again. Because
there are people who will tell you they are afraid of having the surgery done.
Yeah, they're afraid of having the surgery because surgery is surgery. But that's why when you have surgery, you should go to somebody who has the skill. And I hate to say experience, because I just came out of my training. I didn't have much experience, and I stated that I was a pretty okay surgeon. It depends on your skill. Some people have the natural skill. Some people, depending on how they're trained. And so you need to research who you're going to and make sure that person can handle your surgery well and give you good results. I've had hundreds and hundreds of those surgeries that I've done. Thank God, most people, everybody has done quite well, because, my personality, I'm a stickler for detail in a way. So I try to make sure that things go well for the patient, because when things don't go well, it's a disaster for the patient and the whole family.
When a person hears about, when they are told that they will have to do an ultrasound, do they ask the question first, how much does it cost? Usually?
They ask how much does it cost, but since quite a few people have insurance, it's usually covered most time 100% by insurance.
Okay.
What a lot of people don't realize is that if you don't have insurance, you can reach out to the hospital, and they have discounts that they give to people without insurance. So if the bill is $5,000, you don't have to pay $5,000. You can talk to them about, negotiate a more doable fee, and you can have payment plan that can stretch out for 2 years. So
Right.
People shouldn't let the cost really scare them away, because your health is more important than anything else.
I agree with you. Ultrasound is very important, as we discussed at the onset, with pregnant mothers. I recall when I was younger, a pair of mine, a young woman, she had got married, and they went to have an ultrasound done. They were living in Clarendon at the time, and they discovered that the baby wasn't growing right, and they would have had to take it before it started to, mature, for want of a better word. Yes, and luckily she had done that ultrasound, because the child was not going to develop right. So it is really important.
It is very, very important. It is very, very, it's so important that, I cannot emphasize enough. Obviously, you don't want somebody indiscriminately sending you for an ultrasound, really like that. There's some places that do their own ultrasound, and you have to be wary of the fact that why they did so many, we have to mention again. But in terms of the clinical picture, once you're being assessed and your doctor explains to you step by step what's going on, and it makes sense to you, and you need ultrasound, you need that ultrasound.
That's right, and you need to get it done. It's always
ultrasound plays a lot of other roles too, in fertility work.
Yes.
Everybody has heard of IVF, that kind of work could not go on with ultrasound. We have to use ultrasound to look for the eggs and to check out when eggs are coming in, so they can be harnessed by the doctor, and the fertilization can happen. Ultrasound plays a great role also in things like amniocentesis, when you're going to determine whether or not a baby is having any kind of Down syndrome or any kind of chromosomal abnormality. You can amniocentesis when you go in, you need a sonographic guidance, because you will never know where to put that needle to get the fluid if you don't have sonographer with you to help you find the spot.
Yes.
And then you have other methods like CVS, chorionic villus sampling. That's when you're trying to find abnormalities early in the pregnancy, and you need a sonographic guidance to help you to remove the villi, so you can check also to see if a baby has Down syndrome, those kind of things. So it's an amazing role.
Oh, that's wonderful. Well, Dr. Martin, medicine has advanced and continues. Research continues, and people, 3 decades ago, or 4 or 5, we would not be discussing anything about ultrasound, quite possibly. They had some imaging of
there
sorts.
was ultrasound, but it was so limited.
Limited.
I cannot even, like these people 60 years ago, how did they manage those pregnancies? And I remember growing up in the kind of people condition, and they say, oh, she died in childbirth. You used to hear that a lot. She died in childbirth, but she died in childbirth. I said, oh my goodness, these poor doctors had nothing to help them to determine the diagnosis. So people used to just have crises nobody knew about before.
And succumb to it.
Yes.
Vital information
now we're
always.
We're in a different era.
We are.
And we should take advantage of it.
How can they make contact with you if they would like to come in to see you, Dr. Martin? Would you provide them with your information, please?
Yes. Well, my phone number is 212-213-5811. 212-213-5811. And here we go now. My My email.
Dr. Martin.
I'm not quite with the age yet, Lady D. My email is Dr. with a DR, Monica Martin at yahoo.com. And what else do I need? That's enough, right?
We'll take that for now. Doctor.
Because I have so many of these names. I have drmonicamartin.com. I have drmonicaheals.com. The person who did it for me gave me a whole lot of names.
Yes.
So I think you need to put in my name, you'll find it somehow.
So you have domain names all over the place.
All over the place.
The project I'm going to assign you to for next month is that you have your script with all the domain names. It doesn't matter, and just pass them on, and so you and I won't have a moment of laughter.
We only have this moment. But there's a lot of
yes.
drmonicaheals.com, I know that one. And drmonicamartin.com and drmonicacmartin.com. It's just a whole lot of stuff.
That's okay. You have worked hard for your stuff, and that's good. We are very proud of you. A woman from the Jamaican soil who came into this country. You knew what you wanted to do. You studied hard, and you have excelled, and you are blessing everyone who walks into your office on a day-to-day basis. So for that, we thank you, Dr. Monica Martin, and I love you.
I love you too, and thank you for your very kind words.
You're most welcome. We will do this again next month, in the month of, can you imagine,
October.
Dr. Martin? Today's the 8th. What? 8th of September already? All right. So have yourself a wonderful weekend, my Dr. Martin, and we'll talk.
You do the same, my Lady D. Take good care of yourself as you've been doing.
I try my
best. And we'll talk again.
All right. All the best.
God bless you.
All
Bye-bye.
right. Thank you. That's Dr. Monica Martin. Health Zone is aired each and every second Thursday in the month from 7 p.m. to 7:30 p.m. Thank you so much, Dr. Monica Martin. You bring such a difference to the show called Inside the